Yeah, because yeah. Thank you, Dr. Pankaj, for being there. Dr. Kavita, Dr. Dilip.
Yes,
Can we
okay,
start
sir.
now, sir?
Yes, yes, please.
Yeah, okay.
You can display the screen of the Hanneman's board, whoever has got. And welcome participants for the 56th webinar. We have one excellent, promising speaker and a wonderful teacher from Bhavnagar. You already got introduced to him, Dr. Ashish Mehta. And he's here to basically clear up, as we keep saying, the art of history taking or the case taking. The success is maximum almost to the extent of 80%. So the first step, even today morning I was reading, the first step is the very important step. And the first thing is when you actually meet a patient, the first step is the case taking. And today we are meeting and to clear up all these doubts. And for the further proceedings, I request Dr. Dilip Janni to conduct the session with the Hanneman. Over to you, Dr. Dilip Janni.
Yeah. Good afternoon and warm welcome to all of you, all the participants, on behalf of Diary of Homeopaths and Similimum Drop. Today being the 56th continued homeopathic medical education webinar. So first of all, pay gratitude to our master, Dr. Samuel Hanneman. On my honor, I swear that I shall practice the teachings of homeopathy, perform my duty, render justice to my patients, and help the sick whosoever comes to me for treatment. May the teachings of Master Hanneman inspire me, and may I have the strength for fulfillment of my mission. So some request to all the participants, please keep your audio mute and switch off your video. So today, most of the people are suffering from this fluctuations in Wi-Fi. So first check on your side for any fluctuation in audio and video. And we suggest not to put any message when the session is going on. When the sir requests, that time only you can put the message in the chat box. So today we have a wonderful speaker from my hometown, Dr. Ashish Mehta, and he will be talking about the case taking. And Dr. Kavita will introduce him. So over to you, Dr. Kavita.
Good afternoon, Dr. Ashish Mehta, sir, and welcome to the Similimum Drop Group and Diary of Homeopaths. It is a great privilege to introduce Dr. Ashish Mehta, sir. He's a senior homeopathic physician practicing at Bhavnagar, Gujarat. He's attached with Swami Vivekanand Homeopathic Medical College and Hospital at Bhavnagar and runs a chain of homeopathic clinics, Samvedna Clinic at Bhavnagar. He has a rich clinical experience of 30 years and he loves teaching organon of medicine since 20 years. Welcome, sir. Over to you, sir. Dr. Ashish Mehta, sir.
Thank you very much. Thank you very much, Dr. Deepa and all, Dr. Rodrigues, Dr. Dilip, Dr. Yogesh, Dr. Manisha, Dr. Kavita. Thank you very much. And lovely Pankaj. As Pankaj is a student of our college, he knows me well. Am I audible now?
Yes, sir.
Yes, sir. Quite well.
Should I start sharing my screen?
Yes, sir. You can.
Sir.
So we are starting with this.
Requesting all participants to mute their audio. I understand most of us are logged in through our mobile phones because of network issues and the touch screen is very sensitive. So I'm requesting everyone if we can time and again check our videos and audios. Thank you. Thank you for the cooperation.
Everybody can view my slide first.
Yes, sir.
Yes, sir.
Everybody. Yeah, it is viewable, na?
Yes, sir. It is visible,
So
but sound
what
is.
Friend psychology? Hello.
Yes, sir. Sound cut off होके आ रहा है.
That is what the internet problem.
Okay. Okay, sir.
Hello.
Yes, sir. Audible now. Audible.
Man can learn nothing except by going from the known to the unknown. So most of the time when patient come or when we know anything about first time, generally we know something about it, and if we study it properly we can come to the unknown quality of that substance also. The same thing happened with Dr. Hahnemann also, that from starting from the cinchona bark to the whole era of the homeopathic medicines are available now, and this is all based on the similar principle from known to the unknown, and that is what known as the travel of learning. So most of the time what happens that when we come to know ourselves, we can have these four facets. The open self, that is information about you, what you and others know. That suppose if I can say that I know myself up to little bit. Pankaj knows something about it. Dr. Rodrigues knows something about me. Dr. Dilip is knowing something about it. That is open self. Then the blind self comes. That information about you that you don't know, but others know. So how I look, how I behave in adverse circumstances, what are my different kind of the habits, what kind of the gestures I am making while I am talking. This all can be known to the other person, that is blind self. Then comes the hidden selves, that information about you that you know, but others don't know. So many things we have, but we are not openly showing to anybody, or nobody can probably fathom the hidden property or hidden patterns of a person. And then comes the unknown self. That's information about you, and neither you or no nor others can know. So these are the unknowable things. Most of the time, this unknowable things remains hidden. That is very latent, very at a deep level of our consciousness. So it will be very difficult to fathom. But in case taking, if we attempt, again I am saying if we attempt, it is not always we can do the same thing, but in different cases or in a few cases we can have an attempt to know the unknowables of the person or the entity or the energy. Sometimes we can be successful. So our travel start from the open self, that is from ourself, and everybody knows, and then comes to the unknowables of the phenomena. So according to Sigmund Freud, there is personality profile, that is three layers. That is, first is the conscious, what we are conscious of ourselves and what we are conscious of our surroundings. Our surroundings means our home, our work area, our hobby. These are all we are conscious of. Many people are even not conscious of their hobbies also. They have no developed hobby, or they have to be very living at a conscious level only. Then comes the pre-conscious, or sometimes it can be called as a layman's language subconscious also. This is a storehouse of memory and stored knowledge, or many times the superego part, what we have learned through our parents, our society, our teachers, our idols, that remains at a superficial superego part level, and that is how our attitude, our behavior generally become social, or it is a we can do some work in the society within the social norms. These are known as the superego as well as the pre-conscious part or our memories. Suppose we can say that what is the name of the teacher of your third class or seventh class. One has to recall and recall and recall, and some picture visualization comes, and then we can have the name of that person or any habit of that person. Then we can come to know at present moment. So we are at present communicating at a present moment, but if we try to recall our memory of at least 15 year or 20 year back, we can recall, and that is what happens in the probably mesmerism also or hypnotherapy also. So or it can transcend also up to the highest level of past life regression that Dr. Yogesh knows the best. That also can be done. And last comes the unconscious part of the personality, where we are not conscious of our fears, we are not conscious of our hidden desires, we are not conscious of our wishes or very urges or social needs or selfish needs. This all comes at a very unconscious part, and each and every person has all these levels, but the only thing whether they are capable to understand or capable to that is what the question comes in the case taking, because when a case comes to us, we have to put all together in the 3P package. So this 3P in one we have to unpack, and then we can have totality of what is happening at anatomy level or a structural level, what is happening. So this mind, that is conscious mind, subconscious mind, and unconscious mind, each is there, but mostly our social part or our society part is mainly handled by our ego mechanism as well as super ego mechanism. Our unconscious very few time can pop up,
आशीष
or
सर,
we
सॉरी टू इंटरप्ट सर, मैं आपका वीडियो थोड़ी देर के लिए बंद कर रहा हूँ क्योंकि इंटरनेट स्लो लग रहा है.
can comes in while, but an observant person only can notice it. Yes.
यस सर, मैं आपका वीडियो थोड़ी देर के लिए बंद कर रहा हूँ. आपका नेट स्लो है, इसलिए आवाज जो है रुक रुक के आ रही है. मैं आपका वीडियो स्टॉप कर रहा हूँ सर, सिर्फ माइक ऑन रहेगा. यस सर, प्लीज कैरी ऑन.
आशीष भाई, हेलो आशीष भाई.
यस सर.
પ્રીવિયસ સ્લાઇડ અને અનકોન્શિયસ પાર્ટ થી ફરીથી વાત કરો.
એક જ મિનિટ સર, લોગ આઉટ થઈ ગયા છે સર.
હા.
Dr. Kamlesh sir, Dr. John here.
Yeah.
Sir, whenever Dr. Ashish sir is going out of the, because the Wi-Fi is very fluctuating all over India today. Sir, in between you can help us so that the participants understand what has been missed out, because we may go blank a lot of time during the session today.
Okay.
Maybe
I think he was making a very, very important point, and
he will come back, sir. He will join back.
Yeah.
Then you can, whenever he joins back, you can do this.
And he has done a very good integration of the data. The visuals and the presentation is self-explanatory, and in that, if you can just table my screen sharing.
Yes sir, done.
Just a moment. This was the screen you were showing, right?
Yes, sir. You are showing.
You can see, everybody can see the screen?
Yes, sir. It can be seen.
Yeah, great. Now in this particular screen, he was talking about this unconscious level. And this unconscious level, a lot of things which are there, to some extent we know, or the glimpses are at a certain point of time comes to the conscious level or the pre-conscious level, it just lurks up. But the most hidden or the suppressed thing so many times, which is here at the shameful experiences, because that is the one part that we want to deny about ourselves. We want to suppress this. We don't want to even think about it. And so it goes to deep down to the shamefulness, deep down to the unconscious level. And these are the factors, this shamefulness, certain unacceptable things, not only sexual desire, but unacceptable things about a lot of things. We usually operate on the denials. And when we are operating on the denials, then whatever is happening, that it creates a crack within. It creates a conflict within. And these cracks and conflict that really starts breaking us down. That is draining down our energy. And the most important part is that I don't accept myself, or I constantly have to hide some of myself to the level that I become indifferent to that, and to the level that I push that down to my unconscious level. And that is why lots of such experiences which are there from our childhood. Now, what happens in the childhood? One thing, we grow up, we may not remember that, that is one thing, but at the same time, our growth, especially in our uh, culture, what is important is that you should not do like this, you should not do like that. And that social norms or the family norms, they make us to behave in a particular manner. And from there onwards, all those denial mechanism starts coming up. And that denial is to our own self. And that is what this uh, slide that he has made is very, very, very self-explanatory. And in that, the rationality that is taken away, and irrational things. So irrational things, weird desires, something which cannot be explained. You can't stand on that and tell people that yes, this is what you needed. And that is why what happens, the such opportunity comes up, certain situations come up. We behave and we find surprisingly that why am I behaving like that? Or people observe, they find something funny about that. That I never thought that this person would behave in this. There is certain uh, announcement that something is free, and there people rushes.
Kamlesh sir.
Thank you so much. Yeah, Dr.
Sir,
Kamlesh Mehta
this is
sir,
the-
thank you so much. Yeah, Dr. Ashish Mehta sir has joined back.
Okay, I'll just stop
Yeah,
sharing.
today we have a
Thank
Mehta
you very
special webinar. Okay, thank you so much.
Am I audible now, Dr. John?
Yes,
Very
yes,
much
audible, sir.
But
Audible now?
Sir, yes.
I am muted my video and start sharing screen again.
Okay,
Okay.
sir.
Yeah,
Yes.
better sir.
So we were here. Okay.
Yes, sir. Yes.
So basically, most of the time we have three components of mind, that is conscious mind, subconscious mind, and the unconscious one. And if we fathom this, all the three while case taking, it will be the best thing we can have, because we have symptoms of structure, we can have symptoms of physical generals or the physiology, as well as the pathological or deviations from the physiological functioning, then of the mind and of the unconscious also. So this all things can be very useful for the making totality of the symptom. So these are the Freudian concept, that is a structural concept of mind. that is ego, superego, and id. We will not go into the detail of psychology over here because it is too lengthy to make it possible. So it is just a glimpses to first, before taking the case, if we know that person is having all this in his personality, then we can deal it in a better manner. And generally, the patient come with this sort of the mask. We are all very acquainted with the mask nowadays. In present current situation, we have to wear mask, but this is already a mask we are already wearing in most of the time and most of the circumstances and most of the places. This is what called as personality. That is persona. That is a mask. And this is our current mask of COVID, which is very useful nowadays, and one should wear it also because have a precautions to various kind of the virus as well as bacteria. It will be very useful to us. So first we will start with the what is a case, that case taking, case receiving, case witnessing, case perceiving, case understanding. There are so many names of the case taking. Dr. Kant has said individual examination of the patient. In aphorism number 83, there is a individualized examination of the patient required certain quality of from the physician. This all are already given, and we have well versed with the this kind of the details from our source book as well as the most important masters. But basically what I think, that whenever we talk about such words, mostly we convey that we are really interested to understand a person who is sitting in front of us and came in a form of a patient. So as per my experience, nobody come into contact with anybody without a purpose. This is all very well timetabled, but we don't know what is the timetable. That is why we cannot understand it. Probably Dr. Yogesh and most of senior homeopaths can agree with me that a purpose to fulfill the purpose of universe through us. So we are instrumental only basically. Even this lecture is a having a fulfillment of a purpose, and nobody has decided before almost 2 months that this kind of the lecture will be arranged and that person will be available on the 56th webinar and 55 webinar will be there. And I even don't know that my starting, before I start, there will be a Ganesh Thapna, that is Gajanan Dhanipkar has already started. So this is what called some universal timetable, and the patient come to us with a desire to heal, making us instrumental in the process as per the timetable of the universe. So this timetable we cannot believe, many of the times we don't pay heed to it, but it is going on unconditionally without any what we call obstacles. And the similar way, present cyclone system is also going away, still we are attending and we are all together. This is what called the universal timetable. The whole process of understanding a human being is having diseases revolving under some very simple facts. That simple facts, what I have observed, maybe some of them are lacking or some are more. I have paid importance to it, but still I consider it as the simple facts which are very important in case taking. So, first of all, generally we come into contact with the patient, then our observation starts, our communication starts, our medical examination, especially the clinical examination as well as investigation. Clinical examinations, clinical methods of Hutchison or Sikkedas or whatsoever we can call. It has been taught in the colleges, taught in the hospitals or at OPD level. This all are very important to begin with. Showing interest about the patient and his life. The more our interest to understand his problem and his life can be very healing to the patient, because most of the patients are basically are suffering human being, and suffering human being always needs some sort of the energy reassurance. That can happen in the case taking also. While case taking, listening is life experiences and reactions. So there are various kind of the experiences, very joyful, very painful, very sorrow, very accidental, or very, very deep. We can have and what kind of the reaction he has given to the circumstances. These are one of the most important part of the case taking witness. At the same time, taking interest to understand his viewpoint. What is the patient's viewpoint to his life and circumstances, to his life incidences, to his hobbies, to his reactions? These are also very important part of the understanding a human being. And lastly, the understanding the person as in problem, because person already in the problem and having the problem, and if we try to understand them, it can generate a kind of rapport which already mentioned by in ML Dhawale book, as well as in many books it has been known as rapport. And rapport itself is a very healing part as per my understanding. Then the requirement to understand a patient, what kind of the requirements generally, it is not given in any of the book very clearly, but what I have observed in my practice, that is what I am putting forward to you. That homeopath must follow certain points. First, that is a kind of appointment system can be generated if you want to have a full case. That is first primary thing. Second, the consent form. Nowadays, the standardization is happening, and consent form is very important before entering into anybody's life incidences or life understanding. So it should be very well known to the patient that you are going to ask about his problem, his life situations, his relationship, his business, his work output, his workplace environment, all you are going to ask. And for that, the consent form is very much important. Same thing with the time adherence and the appointment are the counterpart, both are the important. So time adherence, time given to the patient should be of patient only. There should be no distraction from the mobile phone or from the any of the other person or from the family or from the outside of the clinic. These all are the very important. So it to prevent the any distraction, that is one of the important. Then comes the confidentiality or the privacy of the patient's detail. Nowadays this is also very important, that we must not leak the data of the patients, because it is all his right, and his right should not be violated. Then comes the record keeping. That record keeping can be done in the paper way, in the audio way, in the video way. Nowadays, video recording is one of the best tool to have the record keeping, because as this seminar is also being recorded, the record keeping is uh, why it is important for me at least. That is, first, I cannot remember each and every word, each and every sentence said by the patient. So whenever I go home and I sit with my work, I can replay the whole thing and re-understand the whole thing in a very well manner. Second thing, from that record keeping, a record, video record, we can have a word to word verbatim transcript of the case. That is also possible, because generally we used to have structured case record, and here you can have a verbatim or transcript of the word to word of the patient. That can be done with the video recording. Third thing, in follow-up also, before follow-up comes, the question is already asked before the session begins, that how to do the follow-up. So before follow-up come, you have given the date to the patient, and before a day, if you view the whole recording, it will be very beneficial to you as well as the patient, so you can recall it very well. Third, if the the patient is not responding to the treatment, and what to do, that you have tried your all the thing, so you can send this recording or make other expert view this recording, so you can generate a second opinion from that also. That is also very big. I have done many times in psychiatric cases. I have done many times, I have took help of Dr. Gandhi also. That's why I am saying it is very important. And third, it can be very useful for the academic purpose, because without seeing a live case, without seeing a actual patient in consulting room, how a person can become a consultant in a homeopathy especially, because it involves a lot of uh, patience and lot of skills of communication which can be learned through the video recording. And last but not the least, that is a certification when required. So patients may require various kind of the certificates, especially from the illness to the death. This all a homeopath should provide, and when he has all the records, then he is eligible to provide such certification, because in medical legal cases we have to provide certificate, which is very important part of the case management. And the process of understanding human being or a patient should be very simple process, not very complicated. And if the process remains simple, the outcome can become the very good. Moreover, it should be spontaneous from the patient. As much as spontaneous patient is, the much more characteristic expression of the patient you can get. So it is not like that we ask and he give the answer. He narrates and we listen. This is what the attitude or spontaneous narration means. And it should be effortless on the part of the homeopath. At present also, suppose I am giving you a lecture, I should not make much effort to do the explanation, or should not remember each and every type which is given in the textbook. This is what has been written, this kind of the question should not be asked, this question should be asked, this way question should not be asked. This is what we have to keep aside, but it should be spontaneous and effortless on the part of the homeopath. So the link of the patient and the wavelength of the patient homeopath remains the same, and the space should be given to the patient to express himself. Space, I mean that there should be enough calmness, enough patience, and enough attentiveness. All together create a kind of space where patient spontaneously expresses himself. And this is what truly an amazing experience, that when you give a space to anybody at your home or your family place or your workplace or at your clinic, if you give space to somebody, natural flow will come very automatically. And during whole process, the attentiveness but non-judgmental attitude should be developed by the homeopath. And it can be done in everyday life also with everybody also. But first we can start with the case taking process. So we should be very attentive but non-judgmental. If we remain not non-judgmental in case taking, most of the time our biases remain outside. And if our biases remain outside, we can remain unprejudiced for a while. And if we can develop this practice more and more, we can remain unbiased during our day-to-day work also, and it will enhance your overall quality as a human being, not as a homeopath, but as a human being. It can evolve you. This is what my experience. I am sharing this experience, and it is not given in any of the books. That is why I have to say. Am I audible, Pankaj? Hello, Pankaj?
Yes, sir, you are audible.
Yes, sir. Yes, sir.
Oh, okay. I am going right way, no?
Yes, sir. Okay. No, please continue.
Thank you, John. So now comes the understanding of a human being. Again, that is what kind of the require we as a homeopath we should have, that knowledge of spoken and local language of the patient. If patient is speaking Maharashtrian, or patient is speaking Bengali, or patient is speaking Gujarati, if I don't know that particular language, then it will create a problem and communication gap can arise. So most of the time, if we use the common international language, that can be the most useful in many of the patients nowadays. But in rural cases, we have to be very knack of the local language, so we can understand and fathom their expression in that rural way. Same way, the knowledge of neuro-linguistic language, or the what we call NLP, or gestures or language, as Dr. Kulkarni has already spoke about much, so I should not speak more about it. But these are the very important part of the communication, and it should be pay very much attention to that. Then comes the level of awareness, or what kind of the awareness is the patient conscious of what, up to which level patient is conscious of himself, whether he is conscious of his only appearance, whether he is only conscious of his designation, whether he is conscious of his qualification, whether he conscious of his position and acquisitions and material things, then it is a kind of consciousness. The another person are conscious of their little complaint or little very minute detail of the local complaint or the chief complaint. That is also at a LSMC level, it is a very important part. Then comes the physical level, physical general level. If they are conscious of what kind of the thirst they have, what kind of the perspiration they have, what kind of the sleep position they are adopting, what kind of the dreams are coming, what kind of the uh, desires and aversions are there. If they are very specified and precise, the consciousness level of the patient is comparatively very good, and it can be utilized at a susceptibility level to measure the susceptibility level also. At the same time, if they are conscious of their thought process, dream process, and the reaction process, it is still better that they can have good command over and that this process is. And lastly but not least, if they are aware of their energy patterns, that is the one of the best way of expressing anybody, and that in very few patients it will be available, but still one can know about this. Then comes Dr. Gandhi's concept of personal evolution model, that is our inner age and outer age is both are different thing. uh, at present, we all have a outer age, that is specific age, position, whatever we call, and there is an inner age. There is an inner energy which evolving and having a kind of age, and this can be reflected through their behavior, their consciousness, their word pattern, their thought process, their dreams. Everything can personal evolution. Just a moment, one call is coming. So this can be used with the proper knowledge of personal evolution model also. So inner age is very important, and the same time the inner age is connected with the ego development. So at which kind the fixation occur or which kind of the reactions they are producing, that can be known to the patient. And the lastly but not least, the empathetic response of a homeopath. Whenever we are with the patient, what kind of the feeling or what kind of the state the patient is generating within us, that is also, if we can observe that part also, it will be the best part from the homeopath. Okay, if we can observe ourselves as a third person in the case taking, the person is in front of us, we are sitting, asking, taking active interest, and the third person is observing both the person, and the camera is the fourth who is noting down everything, because the location of that physician can be very easily be assessed by the questioning as well as the active communication that can be possible. Lastly, then comes the place of the importance. So I am at present working at OPD also and private clinic also. The difference I have found that number of the patients and new cases, the follow-ups are all together, and one has to handle it properly. At the same time, at a OPD level, there will be a planned cases, planned follow-up, and some of the acute cases when it is needed absolutely. So we have to call the patient, or patient automatically comes to us that I have an acute exacerbation of the complaint or a fresh acute case. This all can be possible in private clinic also and at OPD level also. But with both, the working pattern can be different, because at a college you cannot go for a very lengthy case and very attentive thing, because various kind of the obstacles are there, various kind of the cases are there, and the demands of case or demands of the patients to be examined by a particular person, that is also sometimes become the obstacle. At the same time, at your own clinic, you have a leisure and freedom to plan your cases and plan your follow-ups. That is what working pattern one can adapt. Then at present, we are going to talk about the chronic case as per the organon. So I will not go by word to word of organon of medicine, but what I am going to say, it is more about the case taking of the chronic case. And we will not talk about the special cases like acute, how to take acute case, how to take case of an infant, how to take a case of patient with speech problem or autistic problem, or hospitalized patient or unconscious patient, or with advanced pathological conditions, severe psychiatric condition, that we will not discuss at the moment or at present, because it is comparatively a bit different and different approaches are needed for that. And after the initial dialogue with the patient, we must confirm and we must obtain certain information from objective symptoms and about our patient's natures, his habits, way of working and dealing, etc. from the close relatives and family of the patient, because these are the role of attendant or family that can be obtained from the patients. So now this is what generally we do. The art of knowing is knowing what to ignore. That is what the problem most of the homeopaths are facing, that what to observe or what to know, what to ask. This all the things are important because this picture shows nothing to be neglected. Even the person who is drawing the grill of the window, it is also important. The person who is looking beyond the grill, that is also important. And there's a third person, we are looking the whole picture. That person is looking only the window grill and person is looking beyond the window. But we are observing that there are two persons, there are two pictures they are drawing, the room is there with a window. uh, Beyond the window there will be a natural scan or sun, and two birds are there. There are three numbers of trees. This all can be observed in one, and there is a crack in the room, that some cracks in the room that can be observed. This all thing, if we can observe, then it will be form a totality. So we should not neglect anything, just receive everything what you are seeing, not at ease, but we have to give meaning to it. So this is the first step we can take. Whenever patient
Hello, Ashish sir, can you hear me?
Dr. Pankaj,
Yes, sir.
I think he's again got out.
Yes, yes, yes. He's
Request
there.
Dr. Kamlesh. Yeah.
He's still there, but I think his net is slow.
Wi-Fi is weak.
Yes,
So
yes.
whenever it shows picture, no, I think that time it gets disconnected. So you tell him, I think what he's talking, and tell him to mute off the PPT for the moment, and let him continue his talk. I think that is better. And when the Wi-Fi is little better, then to start the PPT again. Okay.
Share the PPT here. That will do, Pankaj bhai, and let him talk.
Yeah, that is better, Dr.
So
Dilip.
it will get shared.
Yeah, because his Wi-Fi is going weak. So let him only
I'll
talk.
just,
You put the PPT. Yeah.
Yeah.
Just communicate. In the meantime, Dr. Kamlesh Mehta sir can take over if he's there.
Yes, Kamlesh sir.
Dr. Ashish is presenting a quite organized presentation about the case taking. Case taking is a subject which is more of a elaborative type of the subject, and putting it into a very systematic manner that requires a very, very organized and experienced mind. And that he is making it in the manner that nothing is just left out. Something very important that Dr. Jani, if you put that that mask.
Yeah, okay.
Before, yeah, this is something very, very important that we have to understand, that we, not only patient, but we all are wearing one mask, isn't it?
Yes, sir.
There is a lot of mask of hypocrisy. There is a mask of impression, mask of hiding, mask of secrecy, mask of that so that we can defend ourselves in the best possible way. Patient comes with the mask, doctor is with the mask. That is what Hahnemann said. How you would be freed? So unless I am free by myself, is it possible that I can make the person make free and make him to put his mask aside? One very important point he said, that is to be empathetic. What is empathetic? That is very important. Dr. Ashish sir is back, and I'm sure that he is going to cover up all such important points. And I'm very eager to hear Dr. Ashish. So please switch over to Dr. Ashish.
Hello.
Sir, I think again he is out of the room.
Yes.
I had a talk with Ashish sir. He's trying again.
Okay.
Meanwhile, Dr. Kamlesh sir can continue. That would be much better. Yes,
I
sir.
really appreciate.
Yes, sir. You want the same slide? Same slide again, sir?
Yeah, put it again.
Mask. Okay.
No problem.
Should I continue?
Yes, sir. You okay, sir?
Hello.
Sir is back.
Yes.
We are here, Dr. Ashish Mehta.
Sir, I will share the slides. You just talk, so the Wi-Fi will get shared. So there will not be any problem for your side.
Okay. 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 So we are ahead of this slide, sir.
Okay, sir. This one?
No. Next.
अब जाओ यहाँ से अपना काम करो.
Yeah. This is what the slide we are talking about.
Yes.
Yeah. No. Previous one, sir. It's our previous one. Hello. Previous one. No, previous one.
Yes, you have talked.
Previous one.
Dr. Ashish sir, the slide.
Your voice is not clear, sir.
Right?
Previous. Yeah.
Sir, the slide was regarding the painting that two persons were drawing, right?
This one, no? Sir, you were talking about this slide, I think so.
Dr. Dilip, the slide takes a while to reach there, so maybe we are not able to coordinate.
Okay, possible, yes.
Just ask him, you describe the slide and you ask him.
Now, which slide can we see on the screen?
It is about the art of knowing, is
Okay.
knowing what we ignore. So that was the painting that two people were drawing.
Right,
Dr. Ashish sir, is this the slide that you want?
No. Next slide.
Next slide. Okay, sir. This one? Hello. Sir, this slide you want?
Dr. Ashish,
Yes,
this is the slide of step 1.
Yes.
Yeah, so go ahead with step 1. Are you able to visit?
Hello.
Is
You can see the slide, no?
Is it audible?
Yes, sir. But voice is breaking.
Hello. Hello.
Yes, sir.
Hello, sir. Please continue, sir. Audible.
Okay. Should I continue audible now?
Yes, sir.
Yes, sir.
Okay. So whenever patient enters in consulting room, welcome them, offer them place to sit. That I have already told that it is a normal social behavior also, and ask them in the most detailed manner that what is their complaint and intention of taking homeopathic treatment. And most of the time, many of the homeopaths are taking complain in a written format before when they take appointment. But what I practice, that most of the time I don't take any of the writing from the patient before giving appointment and after giving appointment. I generally want to see patient fresh before I read anything. So the purpose is that I should not remain very well prepared for the case. I have learned that how to make PDP or IP, but somehow it has not suited me well. And in very few cases, I am doing that. Especially, I am doing seeing the cases fresh and detailed case. Then I make all the decisions about the case. And if they are not aware of the homeopathic treatment method, explain them regarding the, especially at college level, I have to explain many of the patient that what is the intention of knowing such thing, or why I am asking all this information from the patient, that we have to explain them. Even in the very educated patient, those who are not very aware of the homeopathy, we have to explain them. Next, sir, next. Hello. Next. Okay, thank you.
Sir, Achana?
If they
Yes, this
brought,
one.
yeah, this one. Thank you, sir. I will say next. Okay.
Yes, sir. No, okay, sir.
So now, okay. So if a patient came with the investigation report, and most of the patient nowadays come with the files and bundles of the file with them. So it is better to see those files afterward. First, you inquire about the patient, know about the problem, assess your own knowledge of symptomatology, as well as making provisional diagnosis and suggesting any reports. This all first check yourself and then only see the reports, because many a times your way of thinking and the way of thinking of the physicians or neurophysicians or secretaries or different kind of the specialist may differ, and sometimes it is the same, remains the same. So one part it will be a confirmation of your assessment also, and another way it will be a DD can be generated at the same time. So the seeing the reports and investigation and file can be later part, will be the case taking will be good according to my way of thinking. Next, please, sir. Yes, thank you. So whenever any patient come to us, especially after the appointment we do before the case taking, and they fill up the consent paper, and then we generally ask this question to most of the patient, especially in a chronic cases. We are not talking about the special cases which we are not going to talk about it now. But in most of the chronic cases, we generally put forward this question to them first. Tell me about your complaint, your any other complaint about your life incidences, your reactions to your life incidences, your hobby, your dreams, your childhood, your business, your education, about your family, relatives, friends, your habits, addictions, daily schedule, etc., etc., etc. Well, first I giving very general question to them, so I can observe which part of this question they select the first. Because if they select any particular part very spontaneously, it will be easier to explore further. So internet is unstable, it is showing the message, but whether you are hearing me properly or not.
Sir, we can hear you properly.
Okay, thank you. So when I put this question to patient, then I tell them I will ask only if I need to understand more about the particular detail. So patient can be more spontaneous and without break they can narrate, and if only I need, I can have specific kind of question in initial period. And I also tell patient that if I ask anything about more, please try to elaborate more and more so that I can understand your problem or your viewpoint in a better manner. That is what from the very first few seconds I generally convey this message to them, so I can remain as calm as possible, sitting, observing, listening attentively, and perceiving the whole phenomena, in which way they are expressing, in which word they are expressing, which kind of the tone they are expressing. This all I want to first understand. As you are all listening very quietly, no, the observation is not that much possible because I have my video, but this is all can be seen very easily from the patient's way. So next, please.
Yes, sir.
Next.
Yes.
So we are continuing with the step 1 only at present. Ask them to complain in the way to own way to understand their viewpoint, and ask them to narrate about their experiences of life from childhood to the present day. Ask them to narrate their hobbies, fears, dreams, school days, college days life, family life, etc., etc., etc. This all can be spontaneously if they are they can reveal. That will the best part of the case taking. And you can start from anything because patient have started childhood or from the school or from dream or hobbies. What they select we don't know, and whatever they select, try to explore it as possible, as much as possible, so we can fathom the beauty of the same component selected by the patient. So next, please.
Yes, sir.
To narrate.
Yeah.
Previous one, sir. Previous one.
Yes.
Hello.
Yes, sir. Previous one I will
Previous one. Yeah. When we already inform patient that they try to whatever they select, and when they narrate, to give active attention to their narration with noting down their words, their gestures, their expressions, the language they are using, the tone of voice they are using. These all are very important, at which way they are presenting themselves, because every expression from the patient is important here. And wait for them to complete their narration about their present or chief complaint. Whenever they stop, then only ask, otherwise don't ask. Or sometimes you can use the non-verbal questions also by just showing face expression that you have to know more, or from hand gesture you can say tell me more about it, or you can say explain please more in detail. This all the things one can have a communication skill, then it can be very easy to convey the non-verbal gestures. So next, please.
Step 2.
Ask them to narrate more detail about their present complaint. Whenever they are describing their present complaint or the chief complaint, if you ask them to narrate more and more, don't go in a structure way that what is the onset, what is the progress, what is the duration, what kind of the pathology, what kind of the report you have seen, what how it has been started, what it has caused, what are the aggravations, what are the modalities, what are the concomitants. Don't ask in such manner, but tell them to narrate spontaneously about more and more, that give me more detail of this, precise detail, please carefully give the details of this. Then they can recall each and everything which is bothering them the most, because it is the problem for what they have came to you. So it is comparatively fresh in their mind, and when they say in that pattern, most of the time, in most of the patient, you can make the LSMC very clearly. So it will be easier without asking in a format of LSMC. If you make free to narrate spontaneously, you will get LSMC in a most peculiar way that can be very what we can say important for homeopathic prescription, especially at a sector level, what we call it a sector totality level. And if they do so, they can spontaneously reveal the LSMC very precisely, then you have a backup thinking process that patient is completely aware of his complaint, and if we can go further. So if they do, ask them to narrate more precisely about the present complaint, and mostly they will give the very peculiar symptom or particular symptom of the present complaint with repetition of the same kind of the words, gestures, language, voice modulation. This all can be possible, and you can have a better idea of intensity of the complaint as well as the word pattern or the gesture pattern they are using while describing the present complaint. That can be noted very well, but you don't have to do anything about it. Just you have to note it down that they are saying like this, they are using this word, and they are using such kind of the gestures. So it will be useful in the later part of the case taking, when if you want to use or you want to explore the further. Next, please. During this phase, try to note down all the repetitive words, gestures, tone, etc. for future reference that already I have said. When they complete their narration about their present complaint, ask them anything remains and give a pause for a few seconds. So if they have to say or add anything to the present complaint, or sometimes what happens that they recall something and it can be very well connected with the present or it can furnish a very good concomitant with that we should not miss, and that is why a very slight pause is very important at this juncture. And when they ask them remains still remains and pause, and or you see curiously about those patient, this patient, and most probably they will give you some additional information. If they have nothing to add, don't insist them anything. Again, I am repeating, if they have nothing to add, one should not insist to narrate specific things, or at this point, if when they have said everything about the present complaint, we have just idea of provisional diagnosis. Next, please. Dilip sir, next.
Yes, sir, it has come.
Yeah, thank you. So now we have entered to step 3, that if during this time of narration of present complaint, if patient has not any feeling or emotion, suppose if you have mentioned as a concomitant or whatsoever, any feeling or anything that what are you talking about, this feeling or what kind of the emotion that has come up during the last complaint, presenting complaint. And most of the time patient will refer it at a very general level, like weakness or restlessness or tiredness or loss of appetite, loss of sleep, or anger or sadness, or so on. Many kind of the emotions and many kind of physical general symptom can come up with chief complaint. When we can say, or we can ask them, what is the effect of the chief complaint on you, then also the such kind of the symptom, general symptom can be arise. So next, please. So that's what I have said, that ask them about, narrate about the effect of their feeling or emotions. What kind of the emotion has been generated, or what kind of emotion it generates to have such and such kind of disease or such in such conditions. What you feel inside, or what you uh, having, what kind of the emotions you have with this kind of the illness. This all can be Am I audible? Because internet is unstable.
Yes, sir.
Am I audible?
A little bit. It's
Hello?
little bit breaking, but it's okay.
Hello?
Sir, please continue.
If they breaking. Yeah. If they describe it spontaneously, let them continue and don't break the flow. No doubt internet at present breaking our flow, but still bear it with. So when any patient describing anything spontaneously, let them continue their flow and don't break the flow. And even you don't make any gestures or any movement or any distraction that can break the flow of the patient's narration. And if they don't reveal spontaneously, insist them very politely. I again repeating, insist them very politely to express without feeling shy, without and giving them reassurance that details are highly confidential, because many ask about the details of that emotions. Most probably they will hesitate first
Yes,
whether we express this emotion to this homeopath or not, whether we should share our innermost feeling to this person or not. Many times in a male patient this can happen, in female patient it can happen, in a younger patient it can happen, this in any age it can happen, because every age has their own problems, and that we have to overcome by our reassurance and our attitude with politeness that can help. Yeah, next. Yeah, here in the whatever patient is speaking while they are describing the emotions or feelings, we have to listen with sympathy very attentively. We all have sympathetic attitude, but if we flow with the sympathy and we become the one with the patient, we are sailing in the same boat, then it can adversely affect the case taking. So here you have to be very sympathetic, sensible, and attentive, because you are the observer and you have to observe each and everything. So here you have to be very sympathetic, sensible, and attentive for every patient to say each and everything. So each emotions, if they are talking about the anger, the sadness, or the grief, or the jealousy, or whatsoever, you just have to see the undercurrent of these emotions also, from where this kind of the emotions are generating, which kind of the things are surfacing, and suffering to fathom the undercurrent of their narration through their voice, tone of voice, and expressions. Ask to describe about the repetitive feeling or emotions to understand the intensity and frequency of its occurrence. So when we are talking with the different kind of the feeling and different kind of the emotions, you can tell them, okay, which is the emotion which is bothering you the most, or which kind of the emotions are having much intensity. Describe that emotion in a particular or spontaneous way. So they will describe that particular whether it is anger, whether it is sadness, whether it is jealousy, whatsoever. They can describe it in a detailed manner, and here you can explore that particular emotion also. First, we have explored the physical chief emotion, or many of the emotions together, which what he select that is more important. What we select that is not that much important. So next, please. So during this process, try to feel the person with empathy too, without being affected by the same. Become a third person. That is what I am repeatedly saying, that one should have sympathy, one should have sensible approach, one should have empathy also, but that empathy should not hinder your process of being a good observer. That is one of the most important part. So during this whole process of listening the presenting complaint and emotional part of the person, or the story of the person, or the emotional incidents of the person, we have to be with the patient, but without affected by the same, and we can become the third what is going on in present moment of time. Give them enough time to express them their self emotions turmoil, spontaneity if in flow, and only reassure when it is needed. Many of the patient expresses many of kind of the emotion, whether they can cry, whether they can feel very disturbed, very irritated, very angry. This all things can patient can feel at that particular moment, but you have to be with them and calmly you have to just observe and note down each and everything, which is one of the most important. At present also you all are supporting me like very calm and observant, that even though whatever kind of the internet disturbances are there, whatever kind of the voice breakage are there, you are listening very carefully, very attentively, and that gives me a conscious feedback that I have been attended properly, and that is what we need to do with the patient. The same attitude, whatever at present you are developing or developed rather, that kind of the attitude, if we develop with each and every patient, it will be the best part of the case taking and for the patient and as you as a homeopath, that I am sure about it. Next please. So now one can use here in step 3 when they have observed the non-verbal communication from the questions method also here. Previously I have said that one can ask through the gesture that what do you want to say about more, or you can have curious look or question look in your eyes. This all the things can be done with the patient, and most of the patient respond well to that. After completing this, at the most repetitive or intense feeling or emotion, and ask about the most intense incidents related with the same feeling. Suppose somebody has asked, at that time I was very angry, very irritated, very much offensive at that time. Even 2-3 days before I was very angry, very irritated, very much offensive at that time. If you ask that question, what will be the response of the patient? I. Yes, I am unmuted now, sir. Thank you. So, am I audible now?
Yes, sir.
Non-verbal में मत कहना भैया, verbal में कहना. Yeah, thank you very much.
Yes.
So, yeah, suppose somebody is very angry or irritated or offensive at a one or two incidences. We can ask that which was the incidents at that time which is the most intense. So we are incidents what has happened which is not in the present moment of time, but it has past. It was in the past. So you are encouraging them to tell past incidents, and he will describe the incidents which was the most intense for him to feel that feeling. So
Dr. Dilip, kindly wait. Sir has lost.
Yes.
सर पीछे जाओ पीछे.
Okay, sir.
पीछे.
Sir, you are on this slide, sir.
This is it. Yes.
Yeah, we are here now. You can go ahead.
Okay.
Yeah, now
Hello.
I can see. And you can
Yes,
hear.
sir. Yes, sir.
Yeah. Okay. Even in this cyclone, we are doing this. That is very good. We are just maintaining our speed also.
Yes, sir.
Thank you. Thank you very much for all your cooperation. So when patients start the most intense incidents, am I audible? Hello?
Yes, sir.
Yes, sir.
Hello? Yeah, okay. Thank you, Dr. Deepa. When the patient start describing the most intense incidents of the feeling or emotion with fully charged emotion or feeling as if he or she is reliving, mostly when we recall any of the incidents of the very intense emotion with very intensely, most of the and that reliving in the incidents that is in the present moment is very important. Through this incidents, incidents has occurred in the past, but the patient is reliving at the present moment or in the now. At that moment, just observe his expression, words, patterns, selection of the words to describe the incidents or event, and his gesture, as it is very important at this level, because this word pattern and the expressions and the look, they are actually experiencing that particular kind of the event where their emotions at a very highest level of point. That is what we have to observe. And why I am stressing upon the words, because most of the time whatever words we are using, these words we are not using very selectively. Many of the times words come up very spontaneously in the crisis phase, and when this crisis comes, and whatever we use is mostly can almost a window to our unconscious or id part. And that is why many a times, if you use the local language as well as in a very slum areas, you will see such kind of the language in a very intense situation, that they become very offensive or very loud in a certain point of time. And these are the actual expression of their personality. And that is why it is important, because when you be select any of the words or any of the thing, it mostly at a crisis level it will reflect our personality or our inner energy. Next, please. Yeah, thank you. During the whole process of listening, stage 4, when you feel that he or she is almost reliving the experience, gently of the event that you are experiencing at that particular moment or in this particular moment, when you are so angry, so emotional, so loud. At this moment of what you are experiencing at a mind level as well as body level, because part which is common to both is the core, because there is vital force, mind and body. And vital force, if we consider it as energy pattern, that energy can be expressed through various kind of the sensations and the altered functions. So if we can ask at that moment, okay, what you are experiencing at that moment, most of the patient will describe emotions feeling associated with the event which they have already narrated before. But you don't have to rely upon that. You can again ask that without breaking the chain, and be patient at that particular moment. That if you insist or persist for a while, most patient will describe it very beautifully, that they are having such kind of experience, whether there is a trembling in body or numbness in the body or paralytic sensations, or there will be some vacuum feeling, or there will be vacuum kind of the thing, or they become blank at that particular moment, and nothing to do with that emptiness in the mind and body. This many of the expression can be tell by the patient at that moment of time. Please next. So, thank you. At this time, ask again to describe the bodily experience of the event, or what kind of the sensations are where are or there present while this event or incidents. And many of the patient can recall it or experience, because they are experiencing now in front of us, they are reliving the past. Most of the time they can give it to you without any hesitation, and it is words that can be either in the words form or a sensation form, that is disconnected, lacking, empty, shock, intense irritation, hollow, issue related to killing, chase, superiority, competition, jealousy, etc., etc. Whatever it can be, it is not in our hand that what he will say, but these are the true expression of the patient, when patient can be in that particular kind of the framework of the time and experience. Next, please. So these are called, as per Dr. Shankaran has invented certain system that is called the sensation method. As per that system, it can be called as a non-human specific word, which can indicative of a different kingdom. Carefully note down those non-human specific words, that is NHS, what we have called a hollow, vacuum, jealousy, whatever it can be. This can be considered with this gestures, with the words which are coming with the gestures. They are very important to lead further, and one should not focus only on the gesture. One should not focus only on the words, but one can ask about to explore it more, so patient can lead us to the proper direction. Next, please. After carefully note down all the NHS word, ask him to describe himself regarding hobby, past event which has affected him the most, any special event occurred in the life, prize winning or failures or accidents or family event like marriage or any function, dream, etc., etc. So this again, first we have completed a part of the chief complaint. From chief complaint to we have come to the emotional, which is associated with the chief complaint. Then that emotion which is have incidents, then we have to experience of the incidents, and from experience of the incidents to the NHS, this travel, one travel we have made. So we are now beginning to the second area of the life, that is either of the hobby, either of the past event, either of the any special event which patient selects, and any accident or any of the thing patient selects, that can be useful, and explore again in the same manner very spontaneously uh, by can be patient. If the patient selects any event spontaneously, it's best to fathom more about it. One can ask or explore this event very easily. So if patient selects any event, that is better rather than you select any event. Don't select any event. Make them in the freedom to select any of the event from childhood to now, which has affected you the most. You can tell me about this. This is what my routine question excels patients to say more. Next, please. Next, please. Thank you. Let the patient in the freedom of expressing the event and carefully note down words, expression, gestures, tone of voice. This is what we have to do continuously. Noting down the words, noting down the expression, noting down the gestures, noting down the tone of voice. And that is why I have already insisted upon the video recording, because this all together, video can do the best. We cannot do each each and everything very precisely, but video can serve as our best assistant. This is what my experience of this 20 or 30 years, that video can be the very useful in this manner. And when you feel he is at the core of the event, when any of the event, whether he has selected dream, whether he has selected the hobby, whether he has selected the any family event or any of the prize winning ceremony or any of the failures he has selected, but when he is make him to narrate more and more by simply tell me more about it. This all the thing question, simple question can make him express to describe most of the part of the event, and they are at the core of the event. Just make just ask about the experience, that's body and mind, that to get the sensation of that particular event. And most of the time, in most of the cases, we have or I have seen that whatever he is saying and said, that most of the time it will be connected with the past our session. Past session means from the chief complaint to the emotion to the incidents, from the experience and from the NHS, and probably he will say the same kind of the sensation and NHS with this event also. Next, please. Most patient will express in the same word pattern or may express in the antonyms or synonyms, express in the or denial mode, or may feel unable to express anything. Many a times they will say first if they have selected or say jealous about somebody in the chief complaint to the experience level, and now they will say I don't feel jealous about it. In a very casual manner they will mention, but it is a denial mode, and you have to be very sure of this ego defense mechanism also, that they are actually diverting it to the denial way. So this also we can note down. So a part of knowledge of psychology and especially ego defense mechanism can be very useful in case taking, and that's why it is in the already in the first year syllabus, but probably not in so much detail. So here one can use projection method or bypass the conscious mind of the patient also. So in hobby area or any of the past event, one can use the projection. Suppose if it is happening to somebody else, what they can feel. You are denying that you don't feel jealousy. I know, but what other person can feel in such and such circumstances. So probably in that projection way, they can express it very well, and that is to just to bypass the his conscious mind, that I am not feeling that, but somebody else is feeling that. But this is what actually the perception of the person, and it is not somebody else, but the person is already describing himself in a projection way. That we have to note down. Spontaneous and strong denial are very important sensations. Spontaneous denial and the very strong denial are very, very, very important sensation in especially in the cases also, and in our day-to-day life also. It is one of the most important clue that we can perceive something about it. Next, please. Similarly, ask about the sleep and dream patterns. One can say, I have a dream of an accident. Okay, tell me about the accident. So I am dreaming that I am running and one plane is following me, and plane is so huge and it fall on me, and I feel very much fearful, very much frightened at that particular moment. What happens at that time? So much fear and so much fright is there in my inside. So we can say what kind of the fright, and please express more about this fright. And one can say that it is I am perspiring, there will be a rush in my body, and I feel so, there will be palpitation and shortness of breath, and I was purely scary kind of the situation. And we can say still more you can do it, and at that time they can correlate with something like chills, or they feel this is probably the expression of the adrenaline rush. But At the same time, the sensations are different also. Probably I will, if video is all possible, then I will show this example also. We have tried in morning, but it is not working so nice with this internet activity. But this stream, I can show you in the patient's language also. Again, internet, okay. Especially sleep patterns and its variations, positions, somnambulism, bruxism, this all are starting of my practice when patient is telling that he has a tendency to grinding of the teeth every night. And most of the time I take it as a rubric. But when I study the basic sleep patterns and different disorders of the area, especially of the not only as a characteristic symptom, but it can be a common symptoms of primary sleep disorder also. That's what I have come to know, because before that I was not knowing about the bruxism all alone. So this is how we can follow the different kind of the sleep patterns and variations in the, because each and every position has been described in repertory and very specific or very characteristic sleep position can be in the different kind of the medicine, especially Sienna, Medoranum, Soranum. So many medicines describing certain kind of the sleep position with particular kind of the disease that can makes the totality completely different. So repetitive dreams and the dreams having big impact on the patient are one of the most important part to ask further. When patient is describing dream and they describe it very vividly, try to ask them about the what most repetitive dreams, because most repetitive dream or most intense dream are the activation of our subconscious. Because in sleep, generally our ego is not present most of the time, and we are not conscious of ourselves, but our subconscious mind is active at that mind, and that is what the what we call the alpha wave and beta wave and theta wave and all the theory says these things. That is a subconscious state, and where you can have a dream pattern, especially the kind of the sleep. And in REM sleep, when we are viewing dreams and we are thinking, our eye movements are rapid eye movement sleep, which we call as scientifically. And this is what all going on at that moment of time. If you fathom more about the dream and especially about the repetitive dreams or intense dream, you can have an entry to the unconscious of the patient, because dream is occurring at a subconscious part. If you take a step further and you are at a doorstep of the unconscious part, which is a storehouse of the energy and our irrational being. Next, please. Am I audible? Yeah, thank you. Apply the same process. Yeah, thank you. Apply the same process to regarding the dreams. Remain as calm as possible, attentive to make patients remember, visualize, express the dream in its complete manner. Whatever repetitive dreams, whatever intense dream he has selected or she has selected, remain calm and attentive and make him remember, visualize, and express the dream in its complete manner, because dream work is a very big work done by the young, and it is very vast. So when we explore the dream, we should remain as calm and as attentive is best. And when this is the part where we are entering into the subconscious part, and it is difficult for patient's conscious mind to allow the patient and us as a homeopath to enter into subconscious. That is some, because it makes resistance, some resistance at that particular time. Most common is I forget the dream. That is one of the most. I don't remember the dream. It is one of the most common. Mostly they laugh very loudly. That is very common. If we find resistance, the patience is the key. Whenever there is resistance, the patience is the key. The same thing you are all at present attempting, that the internet is the resistance, and still we are keeping our patience. And this is what the key, that our communication is possible. And this is what the same thing we can do with the patient. When there is resistance, be patient with the patient. Next, please. Thank you. The patient which is illogical and irrational. This is what we have to be remember forever. Whenever you touch the unconscious, most of it is considered as a now audible, no? Am I audible?
Yes, sir. Now
Yes,
audible.
sir.
In between, it was big.
Okay. So whenever we enter into we are at the door of unconscious, mostly we come across illogical and irrational expression of the patient. Modern medicine considered as a vague, and that vague is one of the most important in homeopathy, because it is not given in anything in the Materia Medica, it is not given in anywhere in the textbook of Harrison. And between, if it is not between the two cover pages of the Harrison or in any of the Materia Medica, it is one of the most characteristic part of the patient, and which is available in the patient, but still we don't understand. So here the idea of sick nature, or especially refer the natural phenomena regarding this, is one of the most important. So many times we get unconnected expression of in denial form, projection form, in symbolic form, or very strange bodily sensation. Whatever, it is very difficult to say, but many of the people are saying that is severe claustrophobic. So claustrophobic can be anything. It can be any of the experience, but when you join the pattern, the dots of the each and every, from the present complaint, presenting complaint, take a shape, it will not directly come to you. So this is what happens in this pattern forming. These two are most important to note down and relate them with the pattern of the sensation of the patient. So just we have to relate it with. Automatically, most of the time it will be related. But if it is not, you have to make meaningful picture of it. Then it will be easier. Next. Now we have covered almost more than 5 area of patient life. We have covered only at present 2, but most of the time we have to cover 5 areas of the life: the chief complaint, the hobby or incidents or dream or childhood or any of the intense situations or so if we have covered and find out the life story in different areas of the life at a different time zone of the life, and if we are getting similar sensation in all the areas of his expression, we will be sure that we are on the correct path, and you are having the vital sensation or the central sensation, we can say, or the central disturbance. Just I have used the vital sensation word, but it can be central sensation or it can be a central disturbance, whatever you name it, one can name it, because it is open to all. So but the patient expresses so here we are. So anybody can call it anything, but it is known as the central disturbance of the patient. Next, please. Now select the most important NHS word that has been noted down, narrated by the patient, and ask him to describe those words in the context, which is not related to their life. So suppose person has said that I am feeling claustrophobic or I am feeling suffocated. You can select that to explore this word. So whatever spontaneously come, they will express. Most patient will resist and refrain from expressing it very freely because no doubt we are asking for the express something which is not consciously came from them. Sometimes we try to explore through the gestures also. Okay, what kind of the gestures you are making repetitively? So we have observed that these gestures they are making very repetitively. But when we ask about the gesture, most patient will resist and refrain from expressing it very freely because it is somewhat illogical to them also, because they have made it so unconsciously, so innocently, that they will not be aware of that. And once you tell them to express it, probably the resistance can come up. Next, please. Reassure him or them that is to know the real meaning of such words or such gestures as per patient's viewpoint, and not to coming to any of the not for the conclusion, just knowing. It is for the knowing purpose of homeopath or knowing purpose to patient's viewpoint. This is one of the most important. Or a homeopath can apply role playing over there at this juncture. We have to play a bit role or some slip of the words or slip of some language knowledge or skill communication we have to use. So patient will narrate that particular thing. Here you have to play some kind of the role as a case taking procedure. Next, please. If patients start describing, experiencing, expressing the NHS word, be very attentive that he is going to use without being aware of the same, because you have started noting when he enters. You have started noting all the language, all the words, all the important words and gestures very carefully. And once at this juncture of time, patient starts expressing any particular one or two or three or four NHS words and connecting the dots himself, it is not in his awareness, but you can see that he is connecting all the different dots into a one, and that is make she is going to be make a very good picture of that to form a complete sense. Mostly at this time he is describing the quality of a source, and we cannot find this expression in our materia medica most of the time, as these are coming from the collective unconscious field. This is not, but mostly when we are talking about the unconscious mind, there is a one aspect further. There is a personal unconscious and collective unconscious. So that has been divided by given by Carl Jung, who is the disciple of the Freud, and he has given unconscious in divided into two parts, that is personal unconscious and the collective unconscious. So such kind of the things can come up. So I'm saying that this is not a part of present topic, but still when we are going deeper and deeper, I have to elaborate this part also. So this part of the patient's word or patient's expression may not be found in the materia medica, but if you go to the nature and different kind of the substance is available to make a homeopathic remedy, the character of the source can be like this. They are describing actually the source and the source quality. It is very well available in the nature's format, and for that we have to study a lot of natural phenomena and natural substances to understand the basic quality of that particular substance. But here patient may describe the quality of the source at this juncture of time. One should not be prejudiced from the beginning or from using any word, one or two or three word or any particular gestures. One should not be prejudiced that patient is expressing in this way or that way or this particular way or that particular way. If this happen, most of the time the failures is ensured, because it is not the way homeopathy works. The whole pattern from chief complaint to the source word to the totality with the uh, rubric selection, with symptom similarity, with genus, with all sort of the pathology should be included in your totality. Then and then only it works. This case taking process is knowing the person and knowing the medicine and coming to the medicine, but it is not solely depend upon the case, because we are just at present uh, talking about the case receiving process. We are not talking about the case processing process. This process will happen after the case taking. So data analysis as well as case processing is one of the most important part of the case management. So we at present we are dealing with the one part of the case receiving of whole case management. Next, please. Here you can witness, observe, perceive only, but cannot interpret anything. So it is one of the most important part. At this juncture of time, one should not interpret anything, just to observe, just to witness, just to perceive what is going on, whether it is logical, whether it is illogical. We don't know everything, and most of the time we know very less what we actually think about. But most of the time, just if you be witness, it will be the best thing. You can observe a very complete phenomena unfolding in front of you, and you will come to a completely new kind of the you have never thought of. But still it is a learning process, and you will learn it by the patient, from the narration of the patient, and you will find it in materia medica also, from the nature's substance quality also, and from the general understanding also. And this can be the very useful and very one of the best experience one can have during the homeopathic life, that we have experienced many a times with many of the colleagues who have taken such a very good cases. I have seen one person who is taking so superb cases. So almost each and every time, source speaks in front of him. That is what we have experienced. This is how source can be expressed itself during case taking process. It can be very useful to the patient, to the homeopath, and to the whole building up of the homeopathic materia medica, because it is one of the most trusted kind of the clinical materia medica. Next, please. Deepak sir, Dilip sir,
Sir.
next.
Yes, sir.
Yes. Okay, thank you. If during this phase, if the patient becomes aware of the whole phenomena, whatever from the chief complaint to the source solution can occur at that particular moment, because patient has become aware of the energy pattern within. And once we become aware of ourselves, it is purely an evolution of the whole person, whole personality, and whole energy pattern. And that can occur in the patient also. And at the same time, the same process can help us as a homeopath also, that he become more aware about just such kind of the unknown phenomena. Next. सर अभी मुझे शेयर करने देना, थोड़ी स्लाइड बाकी है मेरी तरफ से, आपके पास नहीं होगी वो.
ओके.
हेलो.
हाँ सर, कभी से?
अभी चल रखो, मैं थोड़ा कंप्लीट होने दो, तो थोड़ा अभी मुझे करने दो एक बार, तो मैं आ जाऊंगा उस पे.
ओके
सर, यू कैन शेयर एनी टाइम.
Sir,
I should share.
Shall I stop sharing?
Yes, sir. Dilip sir, you just stop sharing.
Okay.
Yes, Ashish sir.
Yeah, I am sharing.
Okay.
So here we are. Okay.
Yes, sir.
Yes, sir.
Right.
So during the whole process, we should not forget the physical generals. After completing this process, we can ask about the physical generals. It will help to continue the patient to narrate more spontaneously. If the patient is not reveal imaginations, dreams, examples of such persons or incidences, we can ask physical generals at this time also. If in the earlier process, if patient is not that much interested to narrate the experience or incidents or dreams, we can directly go to the physical generals also, because many of the patients are not fully aware of themselves, their imaginations, or their level of awareness is not so advanced. So they may reveal about the physical generals, about the more factual things, about the more material things. Then manage them accordingly, and you can ask or enter into the physical generals. They are also a very important part of a homeopathic totality. And many of the patient, those who are expressing with shy or confidentiality issue are there, to make them comfortable, you can shift your attention to the physical generals, and so they can be comparatively comfortably express the physical generals in a characteristic manner. Sometimes while asking physical generals also, we can have entry to mental symptoms or subconscious part. One of the very important issue in my case presentation has done that one time I was taking a case and I was just asking about the what kind of the desire and what kind of the aversions you have. And patient has said, very elderly patient, almost at the age of 50 or 60, a bank manager was there. He said that I don't drink milk. So I just question, look, I have given the question loan, and he started crying. So I was waited for him. Okay, why he is crying when I have not given any question, or just question, look, regarding I am asking about the milk, and he is crying. What is happening over there? And then he narrated the whole incidents of the family, that his wife has said sometimes, your mother is taking too much of the milk, and on that day he has narrated in a very beautiful manner, and patient was suffering from the severe trigeminal neuralgia, and Simisi Fuga has helped him a lot, because the whole bundle of the emotions and all the aggressions and all the sensitive issues are there, and Simisi Fuga has helped him a lot. So from that physical generals also we can go to the mental very easily, but for that the patience is one of the most important part. And if we are not getting mental pattern clearly, strong physicals will help to form totality. So strong physical generals are one of the most key foundation of any of the case, because it will help you to form the totality. And on that ground also, in follow-up also, somebody has asked me in the previous session that how to follow up the physical generals are improving. It is one of the best sign you can have. And that is what you can observe in follow-up also. So all the physical generals should be asked in such a way. This is a caution also to ask about the physical generals. So all the physical generals should be asked in such a way that it should not become the mechanical or stereotype for the patient and for us also, because we also develop habits to ask about the physical generals in a routine manner. How is your thirst, how is your appetite, what kind of the drinks you like, what kind of the perspiration you are having, what kind of thermals you have, what kind of the menstrual history, what kind of the obstetric history, what kind of the pregnancy history, what kind of the sleep pattern. This all should not be the mechanical, but it should be ask in a very innovative way, and anybody can have a very good communication skill with role playing or in a spontaneous manner. If you ask, most of the patient will give you the clue to the very good physical generals which are characteristic. So don't forget, before doing anything, don't forget to take characteristic expression at a LSMC level, because these are the peculiar symptom of the sector or the chief complaint level. The take characteristic expression at a physical general level, take characteristic expression at an emotional level, take characteristic at an imagination level, experience level, make totality of symptom, repertorization with the correct rubric, study group of similar remedies, refer Materia Medica, that is source book, as well as new Materia Medica, because both are the part of our reality. I am not focusing only on the source book, so I am not focusing only on the new Materia Medica, but I am just telling you that you have to combine, because it is our reality. Old is also available, new is also available, and many new things can be available in future, but what is available to us, make best use of it. That can enhance, and that is why I have uh, extended the whole case taking up to the unconscious part, because now it is possible with a certain type of the methodology or a certain type of the approach. Previously, for 10 to 20 years, we are also taking up to emotional level or the undercurrent of the emotional or the life space investigation or the undercurrent of the life space. This all we were taking, doing at that time also, making rubric from it, repertorizing it. But now the next two steps are already available. So why not to take this too and make the whole totality at an experiential level, and each characteristic expression should be available in a totality, and then whatever we get probably will give the best feedback. And in most of the cases, as per my own experience, this has worked very nicely. And that is why I am telling to all the newcomers, especially those who are entering into homeopathic practice or thinking to entering into homeopathic practice or doing GPs or whatever. But these are the time when you can enter into homeopathic practice, because now at this present moment the popularity of the homeopathy and awareness homeopathy at a very highest level. So it is chance to enter at this moment. It is one of the best part. So refer Materia Medica, source book, old and new, match the genus of the case with the genus of the medicine, repertorial totality, kingdom approach. These all are very important. Not only one. This all thing can be very useful to you. And it involves what it involves, especially the whole case taking process, what it involves. The first is our intent should be very clear that we are going to heal this person. Second, our interest. That interest can be shown from our hard work, from our intention, from our persistence, from our active interaction with all the people, and open mindedness. This all are the very important thing. Knowledge is also a part, because one has to learn, unlearn, and so many things, refer so many books, so many approaches. There are so many schools of thought. This all is available in our reality. But if we integrate all into one, that can called a skill also, and time to apply all above mentioned factors. What we I have already told about the totality. Apply all the factor in it. You remain inclusive, not exclusive. Include everything into one and see what patient is and what the patient is needing. That is what the most important. Here, the patience is also very important part, and after all this, most of the time, art emerges that you will see the whole picture is coming in front of you in a form of a medicine, or a, we can say it is a kind of a gallery. The whole picture is just available to you. And then you have to make the scientific understanding of the case, how this medicine has worked in this case, what kind of the follow-up, what kind of the pathology has resolved, what kind of the impact data generation it has done. This all the scientific understanding of a case is for documentation as well as for our enhancement, is one of the most important part. And ultimately the man is unknown, that according to Alexei Carl, that is, man is always remain unknown. We can know what is present in front of us, not his total past, not his complete future, but what is present in front of us. Try to fathom as deep as possible, as much as possible, and make a totality and give to the patient. That can help as a homeopath and to the patient for the benefit of our science and ourselves too. I think I hope you have understood everything from sharing, because you all are very good homeopaths. And now the result wait that 4:30 there will be a question answer session or question answer. I will do both, no problem. With the permission of the moderator, we can go further. Thank you.
Yeah, thank you, Dr. Ashish Mehta. It was a wonderful presentation. Before we go for the question answers, Dr. Ashish, can you just go to share screen and just stop the share screen?
Yeah, sure.
Because we can.
Yeah,
Okay.
please, sir. I have
Now
stopped
you can
sharing.
close the share screen.
Yes.
Yeah. So we need all participants here. So fine. Can you see me now, Dr. Ashish?
Yeah. Yeah. Sure. Sure.
Okay. Yeah. Thank you so much for a wonderful presentation. It was bringing the whole case taking live, as I rightly say, from the unknown. A great attempt was made to know the person, to go into the in-depth. I will like Dr. Kamlesh Mehta sir to say a few words as a conclusion for your talk, and then we will take up the question answer session.
Okay.
Request Dr. Dilip, Dr. Deepa, Dr. Kavita, and Dr. Nisha.
Should I start my video, sir? Because internet problem is there. So should I start my video or
We
only
will take the
audio?
video. We will take the video at the end. Let Dr. Kamlesh Mehta speak, because there is still a issue with the Wi-Fi at certain areas.
Okay,
Video
no
takes a
problem.
lot of Wi-Fi. So let us finish the discussion, the question answer session, and before we wind up, we'll take the videos. Okay, sir?
No, we are not. I'm not going to tell my video cases. Just unmute my video only.
You want to?
Sir,
Yes, sir.
Yes,
Yes.
sir, you can.
He should
Start
be
the video.
visible.
You
Yes.
can do that,
Yes,
sir.
sir.
Yeah. You can do it before we take the question.
Okay,
Yeah,
okay.
whatever sir is talk in the during this whole session, he can show it in the video.
You can start.
Yeah. Ashish sir, you are starting, or shall I try from my side?
No, sir. We don't want to show any video. Let
Okay.
Kamlesh try to say something.
Okay, sir. Okay.
Dr. Kamlesh Mehta, sir, kindly unmute to conclude a wonderful session of Dr. Yes, welcome.
Dr. Ashish, when you were not there, I just had a chance to talk something about your compilation, your systematic organization of a concept. Concepts are usually at the abstract level. They can be spoken. They can't be put in the manner that somebody else also can implement that. And your attempt is totally in that particular direction, whereby you shared your every actions and the thinking behind your actions. And you have given reasons about it, that what is the success story and the key of your success. Now, you being a academician, you being a teacher, you being a practitioner. So this totality coming up into one particular place and then giving steps of building up, steps of reaching the goal. And that reaching the goal is understanding problem definition. In between, you say PDPRIP.
Yeah.
It was quite quick. So for PR, there is problem resolution. Most important point is PD, that is problem definition. And synchronizing these both are usually the problem because we are much eager for the PR, for the resolution.
Yeah.
And we jump for the resolution. That is why your one statement which you were towards your end of the talk was, we should not be judgmental.
Yeah.
And not to be judgmental is the most difficult task because every point of time, we go on taking some judgment. For every next question, you have to make some judgment. Even when understanding, we require to take certain judgment. So, not being judgmental, that is a state from the point that not to be having any prior judgments. You sit without judgment as a blank sheet, let things come the way it is coming, and let the things make their own connections. And those connections by themselves, they erect as a picture, and that picture it itself gives you that what that it is. So you are not putting yourself anything actively. Now, being a clinician, one side there's a clinical knowledge that is running in the mind. You being a person, there are personal experiences running behind the mind. At the same time, you being a professional person, you have to take a professional decisions at one point of time. So to strike a balance in this regard, that is just like walking on the tightrope. The point is that the moment that rope becomes loose and you lose the balance. And there are factors. The rope is tied up on various those other rods, or there are various factors which keeps that rope tight, and that rope that is kept tight, that is the training. The training, the right training, the right. It is not the knowledge. It is not just the information. We all know. We don't have to be judgmental. We don't have to ask direct questions. We have to tell patient to speak whatever patient wants to narrate. We know everything because we all have passed undergraduate examinations. But what is lacked is the training. Training is what? Training is how would you manage yourself in the situation where usually other people lose the balance. And this training will come up when we hear people like Ashish Mehta sir, who gives a very critical and microscopic details from the experience. Now, whatever he has said, every word which I heard, I would say nothing. There was from imagination. There was nothing from his presumptions. There was nothing from what he thought of. It is not rational or intellectual talk. It was not a talk to impress the audience of 374 plus people. This talk was from the experience, and that experience he has shared, and I would say, Ashish, thank you very much. Very rare people come to share the experience, everybody come to teach. But I'm sure this is a beginning, so I can't conclude your session. Maybe this is a beginning, and you may take us deeper and tell us the various other systems and the methods And the other part of it that you put aside and you have not included in this session, there is various situations which require different spatial aptness to unfold all those situations, like cases of child, cases of unconscious, cases of reserved, cases of psychological, and a lot of other things which we face the situation. But the first, if you understood the basics of what he has said, then basis on this it can be built up further. So it is all what is the interest of the participants and your time availability. Will definitely connect together and move further in that direction. Thank you.
Sorry for the disturbance. Just a moment.
Yeah. Thank you, Dr. Kamlesh Mehta, sir, for a wonderful insight and concluding part of Dr. Ashish Mehta. And we request the convener, Dr. Dilip Jani, and the co-host to continue with the question answer session with Dr. Ashish Mehta.
Sir, if anybody wants to see cases, then I can go to cases, or we can have a question answer session. Both I am open and available.
Yeah, there are a lot of queries, sir, in the minds of participants.
No problem, sir.
Some important questions they have. So you can start with the session of questions.
Yeah, sure, sir.
So I will take up the questions. I'm Dr. Deepa, sir.
Okay.
So the first question is, should we consider the old dreams that the patient doesn't have anymore?
Okay. Okay, any old dream?
Yes, the old dreams.
If it is only for the once, okay.
Right, sir.
Hello.
Yes,
if it
sir.
is only for the once, and if it is not intense, then we should not consider it. But if it is an old one, but still very intense in the memory of the patient, then we should consider it and explore it further. But not at a face level, we should not take it.
Sir, I would like to ask a little more on this. So if during student life, if the patient has a dream of failing or something of that sort, and now during working life they don't have such dreams, so should we take it or should we not take it?
That's what I am saying. If during the
if it is persistent,
if it is very intense in the mind of the person,
right, sir,
at that time also, not at this moment of time, but at that time it is so intense, and if they can describe it very precisely, it means it is very intense and it has